I'm Fred Sledding, I'm Therapy Services Manager here at Airedale. I've been part of the collaborative work across stroke, across Airedale and Bradford. It's been really positive. I think it's taken time. I think a lot of things around relationships and trust. But there's been an eagerness really to improve things and make it work across the pathway. Lots of things, lots of positive things around sharing of information, making sure that practice is the same at both sides and learning from each other and really just generally supporting us to move forwards. From a therapist perspective, well, we've now got a forum where we have the OTs, physios, speech and language therapists, dietitians meeting on a quarterly basis, and we're working on a lot of training competencies really and supporting new staff really for succession planning, but making sure that when new members of staff come in that their competencies are the same so that people get the same quality of treatment wherever they are on the pathway. With thinking about one workforce so that when there's gaps in one area, how we're supporting each other across the pathway and sharing skills.
Dr. James Thomas, I'm a local GP at Fisher Medical Centre and I'm the chair of Airedale Wharfdale Craven Clinical Commissioning Group. For the collaboration for the stroke, we've been involved in terms of looking at the whole patient pathway, and that's really important because it's not also about the patient coming into hospital with a possible stroke and then being managed properly and then going through the rehabilitation. But also what's important is about the prevention, actually preventing people from having strokes. My involvement has been about being part of helping to bring in the whole population and that patient pathway, and being part of helping to collaborate, and we need to collaborate as well as looking at how the two trusts are collaborating. Experience with the collaboration with the two trusts has been fantastic. Whilst we can, specifically with the stroke work, recently the highlights with fantastic results with the SNAP data, which is the kind of national data that we are measured by with stroke, and that has improved greatly for both Bradford and their Airedale and maintain that. So that's fantastic work. Yes, it's great to see the data working and seeing the improvements in the data, but it's far more than that. It's about that trust, that true collaboration, and this has been a real example of that. Going forward with the collaboration between the two trusts and with the CCG is exciting. There are lots of opportunities there. Having a service that's across our system, that's the same no matter where you go, is really important for patients, and as a commissioner I think it's really important.
Airedale has been an initiative to bring our two stroke services together, and we started this journey about a year ago and it's been very successful. For me, the main things were getting the two teams together to understand what our issues were across both sides, and then we were able to learn from each other, to collaborate, to join our data sets together, and to provide essentially better care for our patients across both patches. It's been very successful in achieving those aims, and we look to the future where we are indeed a single service working across site, providing excellent stroke care to the patients of Bradford and Airedale.
My name is Simon Mirza and I'm the Head of Collaboration for Stroke Services, and I work across Bradford and Airedale hospitals. So my role, as I say, spans across Bradford and Airedale, and essentially it's bringing the two providers, acute providers, together to deliver a single stroke service. So we've got coordinated pathways, we look into patient engagement, we have an equitable service across the two hospitals, and what we want to do is look at the end-to-end pathway, so it's not just the acute provider part of the pathway. So my role essentially is project-based. It's work streams around workforce, quality improvement, digital solutions to some of the challenges that we have, performance. We've recently had some really good results with our performance. Our SNAP performance has improved at two hospitals, so that's been really positive. And our working relationships across the two have been absolutely fantastic. Our teams have really worked hard together. We've provided opportunities for them to train together, have meetings together, and that's led to all the improvements, so it's been absolutely fantastic. And our next steps are just sustaining that improvement and that business model that we've got. So sustainability is the key for us going forward.
Hi, my name's Karen Martin. I'm the Senior Healthcare for Stroke and I'm also the TIA clinic nurse. So the good things about the collaboration, we're now a one service, which is absolutely fantastic, which means that our patients will get the specialist treatment that they deserve. They go to Bradford, then they'll come back to us if they need to, and we will then rehabilitate them. So we meet lots and lots of people from Bradford. We've met Stuart Maguire, who is a stroke consultant over there, Dr. Chris Patterson as well. We have Simon, who is the head of doing the collaboration for both teams. I've met Alex, who is the SNAP data, same as me. I input the SNAP data. And so we've, as a team, working together to improve SNAP to where we can get nationally a better grade on our service.